and Drug Administration officially ended the nationwide shortage of Ozempic and Wegovy today. Thanks for joining us. I'm Maggie Weaver.
And I'm Mary Beth Mangrum. The agency first declared a shortage of semaglutide in 2022. Now, some medical experts warn that the shortage could have led to fake products filling the space.
The Tennessee government pushing back against counterfeit weight loss drugs by calling on the FDA to put a stop to them. News Channel 9's Meg Doyle spoke with the Attorney General about the dangers these drugs pose to users.
Maggie, Mary Beth, General Jonathan Skermetti told me that he has seen a large issue with these counterfeit weight loss drugs being sold in Tennessee. And depending on the compounds used in those drugs, it can lead to serious health problems.
Ozempic, Wegovy. Those are just a couple of the GLP-1 drugs used for weight loss and diabetes.
It is estimated that one out of 8 Americans that are suffering from obesity are using the drugs.
But with demand and prices rising, the production of counterfeit drugs overseas is increasing. So are the sales of those fakes, especially in Tennessee.
We saw someone who is dealing fake GLP-1s. Turned out it was insulin mixed with water, and that's a real problem. It was in Medina.
Tennessee Attorney General Jonathan Skermetti led a bipartisan coalition requesting that the FDA take action against those selling fake drugs and the makers cutting corners on ingredients.
You have these overseas manufacturers who are producing adulterated materials, so they don't have the quality controls that they should have. They don't have the safety controls that they should have.
Dr. Jaime Ponce is a bariatric surgeon at the Weight Loss Center of Chattanooga. He says oftentimes patients come in after trying these drugs mixed with other compounds.
People that come and tell us, I tried them and I didn't lose enough weight, or I tried them and I start having a lot of problems and a lot of symptoms.
Dr. Ponce said the best way to tell if a weight loss drug is authentic or counterfeit is to always ask if the drug is FDA approved.
If it's cheaper than the price that I'm telling you, it's just probably not going to be the real medication.
Dr. Ponce said another factor is users not changing their diet along with taking the drug. He says it's important to see a dietitian who can tailor an eating plan for each patient and to also check with your insurance to see if they will cover it. Mary Beth.
Meg, thank you. The FDA says for now it will give compounding pharmacies a grace period to continue making copies of GLP-1s. These pharmacies must stop production in the next 60 to 90 days, depending on facility type.